Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about the need for continued vigilance as COVID restrictions ease. I'm here today with Dr. Jenny Bose, St. Luke's Health System Director of Infection Prevention. Thank you so much for joining us.
Good morning, Lindsay. Thanks for inviting me.
Well, Dr. Anthony Fauci and other health officials are warning of a potential fourth surge in COVID cases as states start to lift mask mandates and restrictions. This comes as highly contagious variant cases are climbing in the U.S. and spring break destinations are attracting big crowds. Dr. Bose, we're seeing cases drop, which is great news, but can you explain why it's not time yet to let our guard down here in the Kansas City area?
Well, you're right, Lindsay. The cases are dropping, and that's a good thing. But we're really seeing cases still at the same level that what we saw last summer. So we're not out of the virus yet. It's still time to continue our strategies, our protection. While we see the numbers decreasing, we still have cases that are new cases that are occurring in and around the Kansas City area.
And some health experts are worried states may be easing COVID restrictions too early with cases of the variant strains on the rise. Can you share more about these strains and what we're seeing with those?
Well, exactly. We are still seeing the cases, and the new strains are even more contagious than what the original strain was. So because of that, then we also know that there are not everybody is vaccinated yet. Not everybody is even eligible to be vaccinated yet. So while we continue to mount defenses to attack the virus and the transmission of that, we need to get more people vaccinated. And in doing that, then it's going to take a little bit of time for that to happen. Historically, we know that the viruses tend to spread more around holidays and big gatherings. And now that we're in spring break, people have this inclination of getting together with all of their friends and family. And maybe getting together with friends and family that have been vaccinated is fine, but going into these large groups is probably not in our best interest at this point anyway.
And vaccinations are opening up to more of the general public. Realistically, how long do you think it will be before there's widespread protection against the virus?
Well, when you look at the numbers and just mathematically, we have still relatively small numbers that have been vaccinated. We have a population that has had the virus, and so in theory would have some immunization. But the reality is that we have still large numbers. The eligibility will be opening up in May. President Biden has indicated that more vaccines will be available in May, but by just the logistics of this, it's going to take time. It takes a few weeks for our bodies to also convert. So probably not seeing, if everything goes well, probably not seeing any relief in our current situation until the end of summer, early fall.
Now, this coming week is spring break for some Missouri colleges. What advice do you have for students who may be traveling or going home?
Well, think strategically. The virus operates 24/7. And so just because we let our guard down, the virus is not letting its guard down. We have to really think about this in terms of a marathon. You work for maybe months and months to run the race, and you certainly want to finish the race anyway. And so we can see the finish line, but we can't stop running, and knowing that we'll get back to normal much sooner if we continue employing the strategies that we have been doing the past few months. I know people are tired. They want to get back to socializing with your friends and family, but now is not the time to let your guard down.
Now, the CDC recently updated its guidelines for the classroom, recommending 3 feet of physical distancing between students instead of 6. What will be important for a safe return to school full time?
Well, again, I think we have to we have to watch the situation closely and think strategically. many of the schools can safely get back to, into operation again. I think that the 3 feet is good for those short interactions. We know that barriers are best, and that being that they need to continue to wear a mask. And hopefully then when they're eating at the various lunch breaks or at snacks, that people will still employ that 6-foot distance. Hand washing, wearing their mask, and social distancing are still some of our best strategies to prevent transmission of the virus. And now that we know that we have the variants that are out there, and it would be foolish to think that that these aren't in our community right now, that we just need to be ready to pull back if we need to. This is an unvaccinated group, and so if you're sick, stay home. When the when the vaccine becomes available, get vaccinated.
Is there anything else you'd like to add? What's your final message for people watching today?
I know people are tired. This has been the long haul. None of us have had to deal with anything like this in our lifetime. But like I mentioned before, this is really like a marathon. We've been training all of this time. We've been winning the battle. We're seeing the numbers come down. We want the numbers to get down to 0. We can get there much sooner if people think before they act and protect themselves. Continue to wear your mask and wash your hands. Avoid large crowds where viruses really can be transmitted. And when you become eligible, if you're not already vaccinated, get vaccinated.
Okay, well, thank you so much, Dr. Bose, again for joining us.
Yeah, thank you for having me.
If you'd like to find out more about COVID-19, including vaccine updates, visit stlukeskc.org/COVID-19. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.